Dawn. I'll be the student nurse doing your physical today. Can you tell us your name?
Connor.
Hi, Mr. Connor. Can you tell me how old you are?
I'm 18.
And can you tell me what state you are in right now?
Michigan.
Wonderful. Connor is alert and oriented. He is sitting upright. His posture and balance are straight and even. He looks to be well nourished and well hydrated. He has a smiling and attentive expression. He has a cheerful mood and affect. There's no obvious deformities. His speech is clear and understandable. He has a good personal hygiene. We're gonna go ahead and look at his skin. His skin is evenly toned. I don't see a lot of scarring or lesions, maybe a little bit of acne, but other than that, there's no excessive tattooing or piercing or anything out of the ordinary. And we're gonna have you smile. His face symmetry is even bilaterally, and we're gonna go ahead and I'm gonna touch your scalp right now, so you'll feel me palpating. His hair is silky, it's evenly distributed, there's no lumps or bumps or gaps noted in his head. And then next, Connor, I'm gonna have you clench your teeth and stick out your tongue. His tongue is midline, his teeth clenches even bilaterally. I'm gonna go ahead and press on your face now, and you tell me if there's any discomfort. Any discomfort? Any discomfort?
Nope.
Excellent. So next we're gonna do a couple of eye tests. I'm gonna be first looking at your eyes to see if there's any obvious issues. There's no drainage, no redness. His eyebrows are symmetrical. His eyebrows and his eyelashes are full of hair, and they're evenly distributed. His conjunctivas are pink and moist. His cornea and irises have no delineation of color, and his sclera are white. So, Connor, we're going to do a couple of tests with the light. And the first one I'm going to do is I'm just going to be shining a light. What I want you to do is look as far across the room as you can in the distance, and I just want to see if you have a corneal light reflex. And yes, I see the light reflex evenly in both eyes. Next, we're going to check for pupil accommodation and reaction to light. So you're going to see the light come in, and we see the direct light response on the left eye, and we see the convergence on the right. And then we're going to do it this way again. You see the direct light response in the right eye, and the convergence in the left. And then, Connor, next I'm going to have you hold your head very still, and I'm going to have you watch the pen light, just with your eyes. So his pupils are equal, round and reactive to light and accommodation. Next, we're going to check out your ears, and I'm looking at your ears, and there's no drainage, no pus, no redness. I'm going to go ahead and palpate the auricle and the tragus. Any pain when I do that? And again, no drainage, swelling, or redness. Any pain when I do that?
Nope.
Excellent. So next we're going to look at his nose. His nose has a slight deviation bump from an old injury, but otherwise it's within normal limits. And Connor, I'm going to depress one side of your nose while you breathe in and out through the other. And this side. Wonderful. Nares are patent bilaterally. Next we're going to be looking at your lips. They're a little bit dry, but they're not cyanotic. There's no lesions, and they seem to be intact. And I'm going to have you open up your mouth and let me take a look inside. His mucosa is pink and moist. His teeth are clean, straight, and he has all of them for his age. In fact, you got some wisdom teeth coming in back there. And And can you stick out your tongue and say ah?
Ah.
Tonsils are about a 2+. Can you do it one more time really deep?
Ah.
Uvula is midline, rises and falls. So the next thing we're gonna do is take a look at your neck, and I'm looking at your neck, and it's normal tone and color. I don't see any jugular distension. There's no bruising and no scarring. And then I'm gonna have you do a little range of motion with your neck. I want you to lean forward, lean backward, side to side. Any pain or tenderness?
Nope.
Okay. We're gonna check the strength of your neck and shoulders. I'm gonna have you push against my hand. And I'm gonna have you push against my hand. And I'm gonna have you push against my hands with your shoulders. Neck and shoulder strength is equal bilaterally. Next, we're gonna check his lymph nodes. And so I'm gonna, I hope you can still see him here. So we're gonna do preauricular, postauricular, occipital, posterior chain, anterior chain, tonsillar, submandibular, submental, and supraclavicular. No lymphadenopathy noted. We're gonna go ahead and listen to you. I'm gonna palpate your carotid artery. First this side, and then this side. And his carotid pulse is positive with equal symmetry. Next, we're going to go ahead and take a look at your chest. So what I want you to do is, I'm sorry, usually I would be walking around my patient, but with the camera viewing us the way it is, I don't have the room to do that. So what I'm going to do is inspect your back, which is the back of your chest, actually. And I'm going to just look, and he has a little bit of acne, but other than that, there's no lesions, no strange moles, and skin tone is even and regular. He's getting no respiratory distress. He's not using accessory muscles. So Connor, what I'm going to do next is place my hands on your chest. And every time I place my hands on your chest, I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99, 99, 99, 99, 99.
Excellent. He's no tactile fremitus is noted. So next we're gonna palpate, and I'm gonna have you take a deep breath in, and expansion is even and equal bilaterally. So we're gonna go ahead and palpate through your chest. You're gonna feel me bumping on you a little bit. You can just breathe normally. And he's resonant where I expect him to be and dull over the bony prominences. Next, I'm gonna go ahead and give you a little tap over your lower back, and you tell me if you feel any pain. Any pain? Any pain? Checking for CVA tenderness, and it is negative. So next, we're going to auscultate and listen to breath sounds. I want you to just take a deep breath in and out each time I place my stethoscope. Breath sounds are clear to auscultation bilaterally. Next, Connor, if you would swing back around so that the camera can see you. And we're gonna go ahead and inspect the chest. I don't see any abnormalities. There's no lifting or any trouble breathing, no accessory muscle usage. His respiratory effort is unlabored. We're gonna go ahead and auscultate your breath sounds. And the same thing, can you just take a deep breath each time that I place my stethoscope? Again, breath sounds are equal bilaterally, and good air movement is noted. Next, we're gonna go ahead and listen to your heart. I'll be listening for a little bit of a long time, so don't be concerned. I just need to listen through your entire heart cycle for each spot, okay? The first thing we're gonna do is look, and I don't see any heaves or lifts. We're gonna palpate. You don't appreciate any thrills. We're gonna go ahead and locate the angle of Louis, mid-clavicular, and go down to the 5th intercostal space, which is where his PMI is. And then we're gonna go ahead and auscultate. Aortic. Pulmonic. Erb's point. Tricuspid. Mitral valve. And we're going to repeat with the bell. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Excellent. So his S1 and S2 are distinct and clear. There's no extra heart sounds, and I don't appreciate any murmurs. Next, we're gonna go ahead and upper extremities. So what we're gonna do is have you hold your arms out. I'm just gonna take a look. His skin is clear, even toned. I don't appreciate any lesions or bruising. His nail beds are pink and glossy, and his capillary refill is brisk. His radial pulses. Two plus, even bilaterally. And then next we're gonna try your range of motion with your shoulders. We're gonna go ahead and go up. We're gonna go out, to the side, and down. And pain or tenderness when you move your arms or shoulders. Wonderful. Okay, so next we're gonna go ahead and do your abdomen check. And so I'm gonna need you to lay down gently. You're gonna lose your table. All right, are you comfortable? Okay, do you have any pain in your abdomen right now? Okay, so what we're gonna do is go ahead and auscultate first. Looking for bowel sounds. Present right lower. Present right upper. Present left upper. Present left lower. His contour is flat. His navel is midline and inverted as within normal limits. I'm going to go ahead and listen to his aorta to check for bruit. And I don't appreciate any bruits. So I'm going to go ahead and percuss your abdomen now. You're going to feel me tapping on you. He's got good tympani in all four quads. I don't hear any dullness where there should be. We're going to be doing light palpation next. No masses or anything out of the ordinary that I can feel. I'm going to go ahead and deeply palpate now. Again, no masses or anything out of the abnormal, and patient tolerated without grimacing or showing any discomfort. So next we're going to go ahead and check his lower extremities. He's got really long legs, so the hair is evenly distributed. There's no bruising, no scarring. I don't see any evidence of recent injury. We're going to go ahead and check his pulses. Post-tibial, dorsalis pedis, my bad. Dorsalis pedis, both about a 2+ bilaterally, post-tibial. 2+ bilaterally. Next we're going to go ahead and check his range of motion. So Connor, I want you to just relax your legs. We're going to be checking how your hips work. So we're going to lift up, we're going to bend, we're going to adduct, and we're going to abduct. And next we're going to lift this side, we're going to lift, we're going to bend, we're going to abduct and adduct. Any pain or tenderness?
No.
Okay. All right, why don't you go ahead and swing back up and around. Okay. For this portion, we're going to check the neurological status that you have. So the first thing I'm going to do is ask you to close your eyes. I'm going to take a soft object and I'm going to touch you in different parts of your body. If you could just tell me where those parts are.
Left cheek, right cheek, right arm, right upper arm, left upper arm,
So his sensation to superficial touch is intact. I'm gonna have you put your hands out, and I'm gonna have you flip them back and forth really fast, a little bit faster. Good. And then now what I want you to do, Mr. Connor, if you would please, is take your heel of this foot and run it down your shin. And then switch to the other side. Again, cellular function appears to be intact. We're gonna check some reflexes next. We're gonna do your brachial first, which is the one up here in your arm. So what I want you to do is just totally relax your arm and let me do the work. Okay? Just gonna move it all. Oh, and you can appreciate the reflex on that arm. See it barely, but it was there. Next, we're going to do the patellar. And you can see the reflex on that side. A little bit stronger on this side. Next, I'm going to do your Achilles. And the same thing, I want you to really relax your foot and your leg and let me just hold it for you. And you did have a downward, slightly downward reflex action on that side. Again, relax your leg, relax it, let me hold it. And it was there, but that was a little bit better. Okay, and then next we're gonna do the plantar reflex, and this might tickle a little. So. Backwards J. We're not getting quite as much of a response out of you this time. No? Man, that one worked well. Let's try it from this angle. Relax your leg. There we go. Now we see it. Okay, thank you so much. So now I need you to please stand. Okay. And I would like you to walk to the door with a normal gait. Watch the light, tall guy. And then when you walk back, walking away from the light, please heel to toe.
Oh.
Can you, yeah, do that again. Heel to toe. Watch your head. Good job. Thank you so much. And then now, let's stand over here outside of the light so that we don't get it. So now what I'm going to do is a Romberg test. And what I would like you to do is put your feet together, arms down at the side. And then what I want you to do is close your eyes and raise your arms out to the side. Good. And then I want you to slightly lift one foot. Excellent. So there was no movement. He had a good balance for at least 20 seconds. Next, we're going to go ahead and check your spine range of motion. And I want you to watch the light. I want you to lean forward. And I want you to lean back. And I want you to lean side to side. And I want you to twist. Wonderful. Thank you so much. This concludes our physical exam. Thank you for being my patient.
You're welcome.